Good day everyone, this is Zxiakira C. Prodigalidad from Nursing 216 and I am here to discuss and demonstrate about proper body mechanics. So first we have to remember that nurses are not exempted from any injury or any type of accidents just because we are medical professionals. We have to remember that the proper body mechanics like proper lifting, proper carrying, or proper pushing and pulling of clients or objects are also required to be taught or also learned by nurses like us. So, first, we have to remember that we are exposed to injuries such as musculoskeletal injury and also fatigue. If we do not know about this topic, we will also cause the client injury if we do not know how to lift them or properly execute carrying, lifting, or pushing and pulling of the clients. So for the assessment phase, we have to remember to assess our environment for safety hazards, and we have to reduce or at least remove them from our way so that we won't have any problems with lifting, carrying, pulling, or pushing the clients or objects. So we have to remember to look for clients that are heavy, obstacles, and also slippery surfaces or any hidden obstructions like hypertension of the client and many more. So for the diagnosis phase, we have to remember to look for impaired physical mobility, activity intolerance, and also disturbed body image and the risk of disuse syndrome. So for the planning phase, we have to remember to prepare all of the materials needed like safety or gate sheet, wheelchair and stretcher with working locks. We also have to make sure that our shoes are non-slip, and also we have to remember to bring the transfer board and draw of lip sheet. We also have to remember to wash our hands prior to the procedure, because by washing our hands we will eliminate all of the microorganisms that can be passed to the client and to us. So now that we have explained all of the procedures, we can now do the proper body mechanics. So first, we have to remember to establish a wide support. So we have to move our feet apart like this. So pretend that we are carrying or lifting a heavy object from the floor. So now the next step is we have to bend our waist and our knees in order to pick up the heavy object on the floor. We also have to remember that if we are pushing or pulling a client or an object, we have to apply continuously light pressure. You shouldn't bend your waist in motion and also twist your waist to the position, because it might cause you an injury or an accident. So now we have to pick up the object on the floor, bend our knees and our waist. We also have to remember to put our head up first and arch our back slightly. So we also do not use our twisting motion or bending motion in order to go to the direction. We use our feet instead. And next, we have to remember that if we are carrying something heavy, we have to put it in our center of gravity, so we would avoid having injury. And next, we have to remember to use safety equipment, because it will also help us while assisting the patients.